guess what? I'm not allowed to go against the CDC, whatever they say. I'm not supposed to ever go against it on YouTube, or else they'll take my channel down. And a lot of people think that's fantastic. A lot of people think that YouTube and Google, which is a monopoly, should be allowed to just censor anybody they feel like. Same thing with Twitter, Facebook, even though it's been proven that Facebook is a monopoly. Remember when they asked, what's his name, Zuckerberg? They said, hey, what other company do you compete with you? And there isn't one.
Jimmy, it's not censorship. It's only censorship if the government does it to you, and not if a private company the size of a small government does it to you.
So you're supposed to be against, first of all, they're doing it in conjunction with the government, you dildo, and they own the government now. So they are the de facto government. The corporations are the de facto. We live in an oligarchy, you fucking idiots. So, again, you're supposed to be against censorship no matter where it comes from. Whether it comes from a government, the church, or a corporation. You're supposed to be against censorship, okay? And if you're listening to a YouTuber who doesn't understand that, he probably lives in another country where they don't have freedom of speech. Yes. And enjoy being misinformed and fed back into the system by watching those. 95% of all YouTubers who consider themselves lefty are just taking your revolutionary progressive energy and putting it right back in that corporate pro-war, anti-worker Democratic Party. That's all they're doing. They're never going to tell you not to vote for a Democrat. You know that. Okay. So why is it that the CDC, so let's get back to this. So why is it that the CDC, a state can go against the CDC guidelines, but a YouTuber can't? They can do it. They do it all the time. So now that they did it here before in California, now they're doing it here. Michigan says it won't follow CDC's more relaxed COVID-19 quarantine recommendations. This is by Kirsten Jordan Seamus. That sounds like a made-up name.
Sounds like 3 people wrote this.
Sounds like 3 different people.
Kristen Jordan and Seamus did one together.
You still working with Kirsten? Not yet, my friend Seamus. So this is from the Detroit Free Press. So here's the story. You didn't write any jokes for this, right, Kurt?
No.
The Michigan Department of Health and Human Services said it won't adopt new shorter federal COVID-19 isolation. So you know what the CDC did, right? So that used to be you had to be quarantined 14 days.
Right.
Then the CEO of United Airlines or Delta got pissed off, and they're like, you know what? We should probably shorten that down to 5 days. Why? And Fauci, I wish I had that video.
Wait, wasn't the 6 feet apart originally 10 feet apart, and then they bargained them down to 6 feet apart?
I'm not sure,
and
but
really,
this
it just turned out to be
I don't
3.
even think there's science to the 6 feet apart.
I don't even know what science there is to that 6 feet. But by the way, so there didn't appear to be any science to this, and a lot of people were complaining about it. And by the way, guess who was complaining about it? The flight attendants. They said that the CDC buckled to corporate pressure.
What? That doesn't sound like them.
Why would the flight attendants want it to be a longer quarantine? Because they say, well, if someone gets COVID, now they're going to make them go back to work early before they're better.
Oh,
so
wow.
that's what the flight attendants are saying. And because there was no test, the CDC said you don't have to test negative to go back to work. Just quarantine for 5 days. So do you see what's happening now?
Whoa, really?
Yes.
Oh, I didn't know that part.
So this is why Michigan's Department of Health and Human Services said it won't adopt the new shorter federal COVID-19 isolation quarantine guidelines until it reviews the supporting evidence, while awaiting additional information specifically for special populations and high-risk settings. Rather, Michigan health leaders say they will continue to recommend previous longer quarantine and isolation guidelines, including those for K-12 schools and congregate care settings. Now, again, I would disagree with the Michigan in this case. It's ridiculous to do this for kids. MDHHS will update Michigan guidance when additional information becomes available from the CDC, said a statement issued Wednesday night. The Delta variant has already fueled the current surge in COVID cases and hospitalizations. The high transmissibility of the Omicron variant underscores the importance of Michiganders practicing the COVID mitigation practices that are known to reduce spread and risk. The U.S. Centers for Disease Control and what? Go ahead, Kurt.
What's good for the Michigoose is good for the Michigander.
Nicely done. The U.S. Centers for Disease Control and Prevention announced Monday it was cutting the recommended isolation period after testing positive for coronas from 10 days to 5 days, as long as a person is asymptomatic and continues to wear a mask for 5 additional days around other people. So that's all they had to do. So it went from 10, not 14, but it went from 10 to 5 days, and then you had to wear a mask for 5 days.
I can't believe that.
They just cut it in half like that. Boom, boom, boom.
But the being sick, I didn't even think of that, of it's to get people so they can't take the time off if they are sick.
Well, that's what,
wild.
That's what that I don't know about that. All I know is that's what the flight attendants were asserting. Mm-hmm. So here, that's because the agency said new data suggests that Omicron variant, this is the science they used. So the CDC says that the Omicron variant of the virus is more transmissible 1 to 2 days before the onset of symptoms and 2 to 3 days after. So that's how they came up with the 5 days. The Omicron variant was estimated to account for about 59% of all U.S. coronavirus cases as of December 25th. So that's how they got the 5 days. That's how they got it. Okay. Caitlin Jetelina, an epidemiologist and assistant professor at the University of Texas Health Science Center, said the CDC issued its new guidance, without providing supporting research that shows people infected with the Omicron variant clear the virus faster than those who had the Delta strain. So she's saying, the CDC is saying that a person infected with Omicron clears it faster than a person who has Delta. She's saying they haven't shown us the evidence for that yet. That's what she's saying. Again, I have to keep saying that's what she said because YouTube will yank this down if I say anything against the CDC. I'm just reporting this story. How about that? In viral clearance, the Omicron is the same as Delta. Then this policy change could lead to significant community spread because people would leave isolation while contagious, according to Jetelina. She wrote that the CDC may have evidence that Omicron is cleared faster, but it hasn't been publicly shared yet, and this information is critical. It seems like you would want to share that information, huh, Kurt? You know, the whole thing with why you changed your guidance and cut it in half. Maybe you'd want to make that available?
Well, Jimmy, what if it turns out the information they saw on the Jimmy Dore show? They have to play.
I wonder where that information... You think you would just make that information available as a part of the thing, but no. So she goes on to say, it's incredibly odd to me that the CDC decided not to end isolation contingent on a negative antigen test, or better yet, 2. So that's what I was telling you. You don't have to have a negative antigen test to be able to go break your quarantine and go back to work.
Oh, wow. I didn't understand
She's saying it's odd to me that the CDC decided not to end isolation contingent on a negative. She's saying it should be, but it's not. That's what that's.
I just assumed that they give you a test. I just assumed
You just assumed it did.
You know, when you assume.
Past studies have shown that some people stop shedding live virus very fast, but other people, especially unvaccinated, shed live virus well past 5 days. So she's asserting that the CDC is not following the science, and if they are following the science, they're not showing the science that they follow, which is sus, as the kids say today. CDC Director Dr. Rochelle Walensky said in a statement that the CDC's updated recommendations, quote, balance what we know about the spread of the virus and the protection provided by the vaccine and booster doses. These updates ensure people can safely continue their daily lives. What the F does that mean? Balance what we know about the spread of the virus, and you're balancing that with the protection provided. What do you mean balancing? I don't know what that. I don't know what that means, but it sounds like mealy mouth doublespeak bullshit.
Yeah. You know what it sounds like? You ever been taking a plane and then they give you some bullshit reason why you got to gate check your bag that they just fucking made up because they're like behind or something?
Yeah.
So you got to like, it sounds like bullshit. Like, I mean, what they're saying is, there's a lot of leeway. We just decide what it is.
Yes.
It's uncomfortable to see what percentage is just them.
We just decided
out of their ass.
She's saying balance, but they're not showing the science they're balancing. Isn't that interesting? By the way, Taiwan rejects not only Michiganders, but Taiwan goosers are rejecting the U.S. CDC guidance on 5-day quarantine. Some Omicron cases still infections up to 12 days after testing positive. That's what the headline says. I'm not saying that. I'm reporting that's what the headline says. Tompkins County is the latest to reject CDC revised quarantine guidelines. What? So I thought that we have to follow the science, and you can't think for yourself, and you can't do your own research. That would be the height of ignorance to actually do your own research. Isn't it amazing how they did that during this COVID? To make you think that you're a dummy if you want to investigate something,
Jimmy,
that you're stupid?
That was in Forbes.
Yes.
When I read that in Forbes, you must not, when it comes to science, you must not do your own research. I'm like, I'm not even smart enough if I read Forbes to do some research.
I was told I'm supposed to get a second opinion on anything from a doctor. So how am I supposed to know whose opinion to value if I don't do a little research? Flip a coin. This guy says have the operation. That guy says doesn't. I guess I shouldn't look into it.
You're just going to go down a rabbit hole.
You're just going to go down a rabbit hole. Have you seen that, Kurt? I've seen comedians on stage make fun of you for doing your own research around COVID.
Mm-hmm.
Oh, yeah. No, like as if it's an intrinsically bad.
Yes, as if you're
the very idea of reading.
Yes. What are you going to do? Start reading? I mean, that's what they're saying on stage. I've seen friends of mine say that kind of ridiculously anti-intellectual shit, and it's dressed up as intellectualism.
Were
follow the science, don't read.
But were any of them people that you felt were smarter than you?
Never.
Because I've heard,
no.
Yeah, it's never somebody I felt deep down was more intelligent. It was always somebody I'm like, you're a little cocky to be speaking on what makes you smart. Like,
so Tompkins County, they're rejecting it. That's from January 1st. They're rejecting it. The CDC got also. This is from rejected Snapple Facts. New CDC recommendation is that there should be no legal limit on drinking and driving as long as you feel fine and do it all the time, or you're going to work. That's a joke. That's a joke from rejected.
It would be
Snapple
better
Facts.
if it was, they bargained it down to just 5 drinks and not 10 drinks.
I'm with you. They should. Why are they doing it by weight? It's encouraging me to gain weight. That's why we got so much obesity. They lowered that drinking and driving. They do it by weight.
Is that right?
Well, no. They if you go to look how many drinks you could have, they figure out how heavy you are.
I haven't drank or driven in so long that I don't know what anybody goes through with their drinking or their driving.
But I never blew a breath level. But
and you're not supposed to.
No.
If you're pulled over,
by the way, if you get pulled over, don't blow the blah, 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 blah. Don't
Really?
do that. No, it's like you never answer a question from a cop either, ever.
It's voluntary to do it?
Yes.
Oh.
You don't have to help them make their case against you.
Oh.
That's why you don't have to testify against yourself in court.
Right. I don't know. I haven't driven. I've been in New York for years. I haven't driven.
So, and never talk to the cops, even if you know you didn't do anything. That's almost the worst time to talk to them, when you know you didn't do anything. Never talk to the cops.
If you're being questioned, you mean? If you're lost and need directions, surely you can.
Yeah, right.
Surely.
Hey, come see a live Jimmy Dore show. We're in Los Angeles, January 7th and 14th. Then we're in Raleigh, North Carolina, and Philadelphia. Go to jimmydorecomedy.com for a link for all tickets and become a premium member to get access to all our premium videos.